things first. So we talked about your neck. So is it turning more to the right, or is it both sides that you feel that you're having the pain on there?
To the right.
Ooh, a lot of pressure up there. And relax that shoulder on the right. There it is.
Wow.
Good.
Oh. That was amazing.
Yeah, that was really good. There it is.
Hey, yo.
Things first. So we talked about your neck. So is it turning more to the right, or is it both sides that you feel that you're having the pain on there?
To the right.
Only to the right. Okay, and then the lower back, it's also the right hip that you're having.
Right hip, lower back, straight in the middle.
So where at in the lower back again? So right into the center, like dead center into
Yes.
there. Okay. So it's right in this area, and then when you turn to the right, you're saying it's right up into the top?
Right here.
So right down over there. Okay, so we're getting some pressure there. And then, so the hip here, you said is more so right into the joint
Oh,
itself.
yeah, exactly where you
Right
push.
where I pushed right in there. Okay. And so it's pretty much just with movement. What about if you sit for long periods of time and when you go to stand, do you feel pain in the hip, or is
No.
it just specifically with certain types of movement?
It's just with pressure
Okay.
on the hip, pain if
Okay, so it's not as much pain as much as it's when someone pushes on that, you're like,
Exactly.
oh, I feel that.
Exactly.
Okay. Ooh, a lot of pressure up there. Okay, so we are definitely seeing some pressure right there on that left side here. And as we go a little bit higher, we definitely see, yeah, right there on that right side. Yeah, okay. So we're definitely getting some pressure right where you're talking about in that area. How long have you noticed that turning when you feel like the pain, like you said?
about 3 months.
3 months, okay. And you said it's more of like a sharp kind of stabbing pain when you
Yes.
turn? Okay. Right there. Okay. So there is some movement actually happening, so that's actually a good thing. Take a look at the left side here. Okay, so we actually have a little bit less movement on the left. So sometimes what happens if a joint gets stuck, the opposite side could actually compensate for it, and then it can start to get more stress because the muscles are getting tighter on that side. Okay, so we do have some restriction there. Let me take a look at your L5 right into the center. Here's 5, 4, 3, 4, and then we have that 5.
Five.
Okay. That's the one.
That's the one.
All right, so we have to work on the pelvis, but in terms of right now, just because this is kind of the one that's kind of screaming at us, we will probably end up doing the L5 to start, but
Okay.
I will want to transition to the pelvis and hips once we get this to get some more relief,
Okay.
just to kind of help you out in the beginning, but then we do want to transition to your pelvis later on. Let's go and take a look at the mid back here. So 1, 2, 3, 4, 5, and then 6. I'm gonna push right onto the T6, T5, 6, and then 7.
No.
Not too bad there.
No.
Let's take a look here. So what I'm doing is I'm looking for just some swelling and some edema. So right there's where we're feeling that. What number is that? 1, 2, 3, 4, and then 5, and then 6. 5, 6, a little bit to the side. Yeah, seems like your T5. Okay, yeah, so we're gonna work on that T5 right in the center. It's getting a little restricted there, so it's not moving as well. But we definitely have some pressure there, but then also a little bit of edema right in that center too. So this is your 2. Underneath it, it's gonna be your 3, 2,
2, a little bit more tender.
and then 3. Is 3 tender at all?
No.
Not too bad. I'll tilt you over to the right side. Here's your 2.
Yep.
And then we have your 3.
2.
More on that 2 there.
Ooh, yeah.
Okay. Tilt you over to the right side. Okay, and that's your right atlas. And then there's your 2.
Two.
Okay. Your C2
Mhm.
is the one that's screaming at you. It's like,
Mhm.
ouch, right there.
Right.
However, what it's doing is it's tilting forward.
Okay.
What happens is when your spine, as it shifts back down on the segment below, the top one responds by tilting forward like this.
Okay.
Now, when the C3 slips back, the C2 will slip forward, and so what's happening is it's kind of straining the joint, but it's aggravating the tissues around that C2.
Okay.
So although your C2 is the one that's kind of inflamed right now, what we're going to do is we're going to go a segment underneath it to the C3 to push that forward, because what's going to happen if I can push that C3 forward, it's going to set that C2 properly. Okay, so we're going to do your C3, we're going to do your T5, and then we're going to do your L5 down below, because that's the one that's kinking over to the left here.
Okay.
So to start, we're going to end with your neck. We're going to start with your lower back first. Okay. Getting right onto your L5, right on over here, rolling just a little bit. I won't drop you. Okay. There you go. Relax that shoulder. There you go. Just like that. Good. Oh, wow. Almost there. Good. No, okay. We're going to get that from the other side.
Okay.
Come on up. Good.
That actually felt really good though.
Yeah, well, we're going to get some more movement. Let's get on that
Okay.
left side. Wow, that was really stuck. It has been this way for some time.
Sir.
All right. What took you so long to get to
I
here?
know.
Relax this knee right here, this leg straight, and we're going to scoot you forward just a little bit. Right there, perfect. Good. And good. This arm. It's going right in front. There you go, just like that. All right, let's see if we can get a little bit more movement on this side. Right there's good. There you go, just like that. Let that shoulder relax. There it is,
Ooh,
good job.
That was good.
Good, deep breath. Let it go. All the way out. Nice and easy on that, good job. Your C2 has definitely got some swelling in there. Your C3, when I do this, that's where it gets stuck.
Mhm.
So I do think that C2 is inflamed, but it's because of that C3 underneath it. So we're going to go ahead and go right underneath that C2 onto that C3. And we're going to get some good movement on that. So relax and unback just like that. Might be just a little sore, okay? But if we get some good movement on there, I think you're going to feel a lot better. There you go, just like that. And relax that shoulder on the right. There it is.
Wow.
Good.
Oh, that was amazing.
Yeah, that was really good.
Oh, I
Oh,
feel like
yeah.
heat, like right here.
Some heat, yeah?
Yeah.
Yeah, well, there's a lot going on right
Tingling
now.
or something.
Yes.
Something's happening.
Things are starting
Wow.
to waken up a little bit, especially right when we've had that pressure on there.
Mhm.
That will release, and then a lot of different sensations can start to happen. Some people kind of feel like a flushingness
Mhm.
happening, just more blood flow kind of going through. But yeah, that was really good. Yeah, so we're definitely seeing it starting to reduce there. So that's looking a lot better here. All right, let's see how this guy's doing down here. Good. Good, 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 good. Let's take a look at the lower. I think you're gonna do just fine around here. Yeah, so we got some pressure off of that lower back, but I think, yeah, it's actually doing better. Okay, so that's where we're gonna leave you at today. Okay, so now there's a couple things just to keep in mind. When we're trying to break up the scar tissue, when we're trying to reposition that joint, we're pretty much creating a new injury to an old injury. And with that comes some healing, right? So it's almost like when you go to the gym, when you do some work, you kind of tear the muscles a little bit and then the healing process comes in. That's where you get the soreness come in, right? So you can feel some soreness with the joints when we get those joints to position. Some people, they don't feel any of the soreness, they just feel really great. If you do feel soreness, make sure you use some ice. Okay, 15 to 20 minutes, just put an ice pack, put it wherever you feel sore. If you don't feel sore, don't worry about it.
Okay.
More importantly, what I do want you to do is just getting some movement.
Okay.
You already got a good workout routine. How often do you go to the gym?
Go to the gym 3 times a week.
Nice.
Monday, Wednesday, Friday.
Okay. For the first 2 weeks, if you can, just let your trainer know. It's like,
Okay.
hey, I'm doing this whole program. Do you mind if I just go a little bit lighter? So
Okay.
if 100% is your like intensity level, just bring it down to 70%.
Okay.
just because I want you to move. I just don't want you to get super sore from a workout and then you come into me and say, oh, I got so
Sore.
much. Yeah. So I just want to make sure I'm learning and figuring out your body in the first couple weeks, and then we can kind of progress from there. Okay. And then the last thing is making sure you're getting plenty of hydration, plenty of water. Are you doing okay with that? No.
I'm terrible with water, but
Okay.
I'm gonna get better.
So they say you want to shoot for about half your body weight in ounces, and especially during summer, you want to make
Yeah.
sure you're getting plenty of water, and especially the days that you work out, we got to replenish your body. So the more fluid we can get in there, the more it's going to flush out some of the toxins in there.
Okay.
Okay, but that's going to be pretty much it.
All
You
right.
did so good.
That was
So happy.
awesome.
Yeah,
Thank
no,
you
I'm
so
glad
much.
that you, thank you for being here. I'm
Thank
excited
you.
that you're here.
I'm excited as well.
Nice.